in Des Moines, Iowa, and we are Iowa's first employee assistance program and provide a variety of services you can learn more about at www.efr.org. I'm very excited to kick off 2025 with my friend Kevin Peterson. Kevin is making his third appearance on the Emotion Well podcast. So he's a Kevin three-peat Peterson for Emotion Well.
That's right, three Pete. Yeah.
Hi, Kevin. How are you today?
Doing great, doing great. Really kind of leaning into the season here, the new year, and just looking forward to what's to come in 2025.
Yeah. So you were one of my first guests in 2020. The podcast started in the winter of 2020, so right before the COVID pandemic. And so did
Yes.
we recorded with you, I think, right before the pandemic, and then we recorded with you at the end of the year. And so it's been a few years. It's been a hot minute since you were on the podcast. So
Yeah, man.
reintroduce yourself to our listeners and kind of share what you'd like them to know, and then we'll get into our conversation.
Yeah, absolutely. I always think of it. It's one of those circumstances, especially post COVID. It's like it's been a minute, or was that yesterday? And
I
so it
know.
really all just kind of feels like such a blur. And you put your all of your personal and other things happening in your life in that in among that it can seem like a lot, but then it goes really fast. But yeah, no, it's been an experience over the last 4 years. I know everybody has had quite an experience. I've been through changes in my practice. I've been through changes in the way we live. My kids have grown up and gotten out of the house, and so that's been a big transition. My wife, unfortunately, in that time period, has had some major health challenges and a couple surgeries and a surgery to come, and so we've had some significant challenges in that standpoint. But all in all, there's been a lot of highlights in that time period. We've really both progressed our careers forward, moving forward. My wife has still been able to uh, move forward in her career and in her workplace, and just find that supportive environment that she needed. And I've been able to really kind of stay committed to the work that I started. Really way back when I started my practice, and I started the practice in Des Moines in 2013, but I was practicing as a alternative health provider since 2007, and it's really kind of on the same spirit. So really kind of seeing that forward and getting further education. I'm now certified as a lifestyle medicine provider through the College of Medicine, Creighton University. There's a Master's of Science in Integrative Health and Wellness that I completed over the last couple of years. It's been about a year since I completed that, but it was 2 years through that time that we were going through that challenge. And so a lot of things that have moved forward. I've changed offices a couple times in that
Yeah.
time period. Just in that transition out of COVID, we had a big wellness center, and it was starting to kind of be a little bit in flux, and the COVID is kind of the nail in the coffin for a lot of those kind of boutique wellness centers if they
Yeah.
don't have a really good footing. And so that transition, kind of finding my new professional home, and I think I've found that here in West Des Moines, and I'm feeling pretty comfortable in this space. And so it's been a lot of good transitions, a lot of good movement forward. A lot of highlights, a lot of challenges, a lot of adjustments, but overall a whole lot of personal growth, professional growth. And so I'm glad to be here now talking to you.
Yeah. Well, when you said that, you completed your master's from Creighton, and I just think about so I see Kevin once a month because he's my personal massage therapist. And so I remember when you told me you were starting that program, and here we are 2+ years later. So kind of going back to that concept of time and how it's just kind of fascinating how quickly it goes, or sometimes how slowly it passes. But
For
so
sure.
I've known you since 2009 when we met back at Drake
Yeah.
University. You were a student earning your undergraduate degree. I was working in the wellness center. We ended up sharing a workspace. You came and did body work for the Drake community, so faculty, staff,
Yeah.
students, and that's how I got to know you. And I just think it's really cool. I followed you both professionally, but also personally because you're a friend of mine. And I just think it's great how you've evolved into, the person you are today. And so for our listeners, if you have not taken a peek at the past two episodes that Kevin did with Emotion Well, the first one was about his personal lifestyle transformation. So how he found a sustainable, healthy lifestyle that helped him become healthier in terms of his overall total well-being. And then our next episode that we did, which was the last one, was about normalizing a healthy lifestyle. So it started with your personal journey and transformation, and then we segued into how other people can normalize a healthy lifestyle. And so today I'd like to just revisit that conversation. And I'd like to hear from you because a lot has changed in the last 4 years, I think, for everyone. I mean, in any one person's life, there are going to be significant changes over a 4 year period, right? And so for you as a person, so let's talk about you as Kevin, not the business that you have, but you as Kevin, how have you evolved and what has happened in your life that kind of brings you to this moment where you say, I'm really glad to be here. I'm glad to be in the space that I'm in.
Yeah, thank you for that. I think I'm a big proponent of personal reflection and utilizing that personal reflection to see yourself as you are in this moment, and then see what that means for your vision forward, and then really kind of looking at common themes. I do this with myself, and I tend to meld my conversation, personal and professional conversation, together, because I really feel like I've always tried to bring my whole self into my profession. And I'm in this profession because it is so connected with me personally, and it's a personal endeavor, for myself, and I hope it's a enriching and fulfilling endeavor for anyone I have the chance to serve and the honor to serve. Um, and so that evolution kind of for me kind of goes hand in hand. I'm always kind of that check and balance a little bit, that what I'm doing personally is in line with not only my personal goals, but where I want to see myself go, as a whole person. And that
Hmm.
includes my career life and my occupational health, I guess you can put it
Yeah.
that way. But in that standpoint, I feel like that I've gotten even more focused on the reflective nature, of my personal living and the way that I live personally, and I think I've been there from time to time, in throughout my journey through, especially over the last, 15 years or so, kind of working up to this point personally and professionally. And even at points in my life before that, I always felt like when I was most in a reflective and open state, because a reflective state for me is an open state. It's where you're open to potential, you're open to possibility, and you're meeting life as it comes, but as yourself. And if
Hmm.
that makes sense,
Yeah.
right? You're meeting life as it comes, but as yourself. And I feel like that I've been able to reacquaint myself with that spirit over the last 4 years. Because going through COVID, somebody asked me, "How are you dealing with this?" It's like, well, the best thing that I could come up with is that I'm just looking for opportunity in the chaos.
Yeah.
And sometimes when life gets chaotic like that, and you just have no idea where things are going, then the trust is in yourself. And I've really tried to root myself into that, especially over the last 3 years or so, as my wife Joy, has gone through her health challenges, because she was in a really, poor state. It was really, concerning, really dangerous state that she was in, before we were able to find the right care for her. And so that was a tough point in our lives, and the treatments that she's had to undergo, the surgeries have been very taxing, for her, and in reflection, for myself, and so just rooting myself into my own personal practices, and my own well-being while I'm caring for her,
Sure.
and seeing forward all of the professional things and carrying that forward. And I have a saying that I've worked with for a while, is that when things are up in the air and really feeling chaotic, the best thing that you can do, and I've told my kids this time and again, is just focusing on what's working. Focus in on the things
Yeah.
that are working for you right now,
Uh-huh.
and really lean into that, because if you can do that and you can preserve what's working, you can preserve the health that you have. I like to say, in the health and wellness standpoint, if you can preserve the health that you have, in that whole person standpoint, then thing generally, most generally, things will work out as they need to work out
Yeah.
in those chaotic standpoints as parts of your life,
I love that. And I think that can
because you
apply
put that.
to all dimensions of well-being, right? Like
Correct.
whatever you're
Absolutely.
doing financially, whatever's working, stick to what's working.
Stick to
Physically,
what's working.
emotionally. I love that. I love that.
Yeah. 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 And that's really the heart and soul of of health and wellness in my and from my standpoint. And that's really what I try to bring forward, when I'm working with someone professionally on the lifestyle medicine standpoint. And even, we're working on some virtual services and some virtual group services, group health coaching, group mentoring, and things like that. And that's really at the heart of it, is getting individuals to start to look at their lives and look at themselves and say, okay, who am I right now? Where would
Mhm.
I like to go? But what's realistic for me in this moment? And how
Right.
can I take the spirit of where I'm headed and apply it to my everyday? And
Right.
so, in a standpoint, but first, establishing what we call the foundational healthy living practices, which is based on what you're doing already. Because
Hmm.
most people, when they're coming uh, to a podcast like this, there obviously some interest in health and
Right.
well-being.
Right.
Even if you haven't taken a lot of action yet, you're interested. And so
Uh-huh.
this is action. Contemplation is action. I think, and I'm not going to go, decry
We're not
the
going to do
language that's
stages
been.
of change.
Yeah, that's right. Yeah, I'm not going to go down that rabbit hole, but yeah, I think contemplation is action. All of it is
Sure.
action. The mental pieces and the reflective pieces, that's action. That is so much value in that. And I think we tend to like launch right past that. We want to find kind of we have an idea that somebody else knows what we should be doing, and then we find that thing, we try to plant it in our lives
Uh-huh.
before we take a look at ourselves. And really, what our process is, it's process oriented, so it's non-prescriptive. Purposefully, it really leans into that process of self-discovery, discovery of what your vision is and who you are in this moment, and how you can effectively, as you move forward in
Yeah.
that way.
I love
So,
that. It kind of reminds me of in Al-Anon, which is a program that I'm a member of. We have the three A's. It's awareness, acceptance, and action.
mhm. Sure.
And, like in my personal experience, like I became aware that there was, an issue in my relationship with my former partner as it related to drinking. But that acceptance part was hard.
Yeah.
And then, you kind of jump into action. You go like, I'm aware of this, and now what do I need to do? But if you can't sit with that acceptance, and that could be accepting that you have no control over it. It could be accepting that you're going to have to make changes. It could be accepting that you're in a certain stage in life where you're only capable of doing so much, whatever that might be. And I think that this doesn't apply only to like an Al-Anon program, but it could apply to a lot of
Yeah,
different lifestyle changes or
for sure.
circumstances that you might find yourself in or needing to make. But yeah, I love that. I just like where you are now and where you want to go, but all that stuff that's in between, those are kind of the hard
Yes.
questions. And that's where a lot of that work happens, right? Because you have to dig in and you have to figure out, okay, so this is where I am now. And if I want to get to, I'm at point A and I want to get to point B, but what are all these little mile markers in between? And how can
Right.
I, embrace who I am and what I'm capable of and what I'm comfortable with to get to that next stage. So
And how can you do that in every standpoint, in every stage, and in every day? Every day that you wake up, you could say, "How do I feel today? What are the
yeah,
demands of my day? And how can I meet those demands in the best way possible?" And while still, doing some things that are forward looking,
yeah,
right? And still building upon that success of each day. So it really is. We're on Instagram and Facebook and stuff like that, and we're putting some things out there. And we one that we put out there here just today actually was that health is a daily practice, and it's what you do every day that matters most.
yeah.
Yeah. So
I'm
healthy living is a daily practice, and then what you do every day is what matters most. So that's what you build upon.
I love that. I'm taking notes because I want to include in our show notes for our listeners a link back to Norma, which we'll talk about Norma. Norma
Oh
is
yeah, for sure.
the business that you just
Yeah.
referenced. But um
Yeah.
you mentioned something really interesting, and so I'm kind of dovetailing off of my notes here. But
Yeah.
people, do you think in situations where someone is trying to make a lifestyle change related to their health and well-being, do you think people look backwards more than they look forwards? Do you think they sometimes look to the past in terms of, well, at one point I was able to do this, or at one
Mm,
point this, type of lifestyle change was super easy, or I used to be able to insert whatever it might be. I used to be able to
right.
have this type of an exercise routine. I used to be able to eat this way. I used to be able to only get 6 hours of sleep a night and feel ready to go the next day. Do you think people sometimes look backwards more than they look forwards, in terms of like, yeah, I think the past can be a great place to look for benchmarking and, just like lifestyle changes and successes and things that didn't work and did work. But
Right.
what about moving, like looking forward, like future forward thinking?
Yeah. So what came to mind when you were saying that is, and that's a great question. I mean, and I think that is something that is a challenge, is that looking back and looking at what was, because I mean, and that's natural and that's
Yeah,
normal, and that's normal because who are we but a compilation of our experiences, and if we haven't learned from those experiences, then we're not going to get very far if we're not open to learning. And so what came to mind is that it's really about how you're visioning, how you're looking at
sure.
your past. And so are you being comparative? Are you using it as comparison, or are you looking at it as information?
Right. Yeah.
And so if you're looking at it from a comparative standpoint, then you're looking at something that will never be currently, because that's what was then
Uh-huh.
under those circumstances, in whatever condition you were at that time, and with the resources you had at that moment. And so you'll never live that point in time again. And so naturally, what you'll experience in this moment will feel different and will be different. And so if you try to go back to exactly what that felt like before, you're never going to find that.
Right.
But if you, yeah, if you can look at that experience and say, and look at it for a gleam out some information, say what went well for me, what really worked for me, what did I really enjoy of that experience, and how can I bring elements of that into what I'm experiencing, my circumstances, and in honor my condition now, honor my resources, honor my those things there. But you bring elements of what you enjoyed of that, and that's really the question. Is not necessarily how can I get back there, but what was valuable of that? What made that valuable for me, and how can I bring that into my life as it is now?
Yeah, absolutely. Earlier you referenced your most recent degree from Creighton University, and could you
Yeah.
just repeat what that is? A master's level
It's
degree,
a
correct?
Master's of Science in Integrative Health and Wellness
All
is
right.
is what it is what that program is, and it comes with a certification. Part of that is being certified as a lifestyle medicine professional,
So
and that
that's
was through the, yeah.
that was my question. Just for people who maybe are unfamiliar, can you describe what a lifestyle medical professional is?
Yeah, so we're the folks that when your doctor says you need to change your diet or you for this XYZ reasons, we're the folks you come to say, okay, how can I get this done and what does this look like for me? Because your doctor can give you a list of they can throw the DASH diet at you if you have high blood pressure, right? They can
Right.
throw you a low glycemic diet if you have diabetes or you're pre-diabetic or prescribe a medications and things like that, and not to decry medications, but medication is a stepping stone
Sure.
if you are wanting to really get to the point to where you're turning things around. And so we're the ones that you come to really create those strategies for yourself and really take that reflective look at what you are doing and what you can do to take what your doctor is suggesting and saying, what does that look like for me?
Yeah.
Right. And so it's either you'll come to it either after you've had an event like that where a provider is showing concern for your health, is asking you to show concern for your health, or you just feel like, okay, I'm changing. I don't have the energy that I used to have. I feel like I'm at a point in my life where I'm ready to start focusing in on health, but I don't know quite how to get it rolling. I've started on a few things, but it just feels like it's kind of hodgepodge. How can we really take that look and make it work and put a plan together, strategies together that are progressive and that you can make progress on, and really focus on the process. So
Is it easy for people to locate providers such as yourself if a doctor were to make a recommendation? I'm just thinking, whenever you need to visit, a physician for, let's say it's related to cardiovascular health or
right,
musculoskeletal health, oftentimes you just go and you look and see who's an approved provider in your network if you have health insurance, and then you make your appointment. But
right.
I'm just curious, is it easy to find individuals such as yourself when someone is in need for that?
I wouldn't say easy per se. I think there's a few of us out there who have planted the flag,
Yeah.
right? And so I'm in Des Moines as Peterson Holistic Lifestyle Medicine. And so if you search lifestyle medicine, hopefully you'll find Peterson Holistic Lifestyle Medicine. But what I find is often people don't know what lifestyle medicine is. They don't
Right.
know that that's the service that they need because frankly, a lot of practitioners, it's not on their radar or in their common language yet either.
Right.
And so we're kind of an elevation of health and wellness coaching, if that makes
Yeah,
sense. And
so
so we're
for a
kind of
lot
that.
of individuals, they might encounter health and wellness coaching through their workplace, say that maybe their employer provides some kind of
Right,
health and wellness coaching or a wellness incentive
right,
program where they can earn points or get a reduced health insurance premium by connecting with a health coach. So I think that's where a lot of people
yep,
get exposed to, you know, kind of the alternative approaches to healthy living and just kind of that gateway. And then you're kind of in between that and a medical provider that you'd see in a healthcare facility.
correct. Yeah, I think we're more trained and more skilled at focusing in on true health elevation, if that makes sense.
Yeah.
So we go beyond the strategizing, and it's all about your strategy, but it's then how is that strategy working for you, and how can you relate that to the medical challenges that you might be facing. So it's that integrative approach, and so
Sure.
that's like why something a program like Integrative Health and Wellness is putting the pieces together because we know any of us that have been in the medical system for any reason knows it's kind of fractured. We have specialists here, specialists there, specialists here and there, and they don't talk very well.
Right.
And a medical provider, unfortunately, is not going to talk to me a lot about your condition. It may be ego, it may be legal. I don't know.
Yeah.
So I don't know where the intersect is there, but even medical professionals have a little trouble talking amongst themselves. And you kind of always referred back to your primary care, which there's a lot of great primary care folks, but they don't have a lot of the time that you need to sit down and go through that reflective process.
Sure.
And that's really who we are. What I'd like to think of as a lifestyle medicine professional as a support for a primary healthcare provider to say, okay, what are the things that you can do to start to move your health in a positive direction? And really, for an individual, again, that's not coming from a healthcare provider, what is the health that you see for yourself, and how can you start to move yourself in that direction in a progressive way, and really orient yourself towards that vision of health, if that makes sense.
Yeah, absolutely. So let's segue into talking more about Norma because you've said we, and I know
Yep.
there's Peterson Holistic Lifestyle Medicine, but also you and your wife Joy have launched
Yep.
a new business. Well, it's not a new business. How would you describe it? It's a new branch within Peterson Holistic, correct?
Yeah, well, I think it's just an evolution of what we've been doing in our larger practice when we had other providers, and it was always that spirit of supporting folks to go through that process of figuring it out for themselves, right? And so providing support and resources for people who are health focused, like we
Mhm.
talked about before, but haven't quite figured out how to put all the pieces together, and maybe aren't getting the support that they need to really make the commitment to healthy living in their daily lives.
Okay.
And so we're that support piece. And so what we center our practice, and Norma again is an extension of what we've been doing as Peterson Holistic Services over the last little while, beyond the manual therapy piece. So in more of the health coaching, lifestyle medicine aspects, but this is our virtual presence. And so we're these are our virtual services, virtual group lifestyle medicine practice, and it really is centered around that support system. So it goes through a lot of what we talked about through those reflective processes. There's a community aspect as well to it, where you can be a part of a community of folks that are also health oriented. We like to say that are health oriented and working toward their vision of healthy living, whatever that looks like for them. So there's really that aspect of openness, and what we really like to lean into are three things. And so one is health literacy, and I know that's kind of an ambivalent word a little bit, but health literacy, what that means for our practice, and what we hope it means for the folks that are going through our process, going through the healthy life system. There is one, it's that personal vision of what health and healthy living means to you, how you see yourself healthy and at your where you would like to be over the next number of years. It doesn't have to be your ideal even, but where do you see yourself realistically being if you start now? But then also being honest about what are the current societal and support systems that are available to you to fill the gaps in your skills and skill sets, and where you can go for learning and testing if you feel like you need it, if you want to go through that. So that's health literacy. It's one, how do you see health, and then what are your supports that are available, and we're definitely one of those supports. And then the biggest piece though is really leaning into personal autonomy. And again, kind of a heady, what autonomy is,
Yeah.
right? Being in the field, and anybody that's been immersed in the wellness field knows what personal autonomy is. And really that comes down to be feeling like you are making your own decisions, and you're making decisions for yourself, and you're confident in being able to make decisions for yourself. That's really where personal autonomy comes in, and you have yeah, go ahead.
Oh, I don't want to interject too much, but
Yeah.
with regard to personal autonomy, I do think that oftentimes when you reach more of that formalized healthcare aspect of the healthcare system,
Mm-hmm.
you lose some of that autonomy, right?
You feel like you have, and it you can lose it if you're not confident enough to be able to advocate for the care that you feel like is right for you.
Right. And I think
Yeah,
confidence is built by having information, right? If you don't know your options, you
correct.
don't have any. That's what someone told me once when I was going through, well, when I was pregnant with my daughter 8 years ago, the birth educator had kind of a, I would say a different approach, an alternative approach to what you'd commonly find in maybe a hospital-based birth ed class. But she was like, if you don't know your options, you don't have any. So know
That's
your
right.
options before you get to the hospital. And I've used that. Shout out to Amy Brooks Murphy from Des Moines. She does
That's awesome.
a really cool kind of, birth ed class with,
Oh,
women
nice.
and couples expecting babies. But anyway, if you don't know your options,
It's
you
so
don't have
important.
any, right? And so confidence is built when you have information, and information is usually, knowing what your options are. And so I just think there are a lot of people that feel like they either have no autonomy in their healthcare decisions, or they don't realize that they could have autonomy because they don't understand that there are options and there are different paths. So if you're diagnosed with cancer, what are your options, right?
Right.
And how can you navigate that? So
Yeah, that's absolutely right. That's absolutely right. So it's that navigation, and it's coming into every interaction with a healthcare provider, knowing what knowing what you're coming for and being able to communicate that, and also having an idea of what you would like to receive and being able to communicate that as well.
yeah,
Because we've
absolutely.
had to do that with my wife's condition, because she has a rare, not very well known condition, and we've had to time and time again say, okay, this is good information and these are good suggestions, but we don't feel like this is exactly what's going to move forward. And I know I have a lot of background. I have a bachelor's in biochemistry and a master's in integrative health and wellness, so I have a little bit of a leg up. But really, that's what we're trying to put together is a system that supports individuals to feel like they have that ability to investigate.
Yeah,
And if they're uncertain in their ability to investigate, then if they're a part of our programming, and really not even our programming, they're part of this community that we're working to bring together, then we can be there to support them with our ability to
sure.
do that investigative work. And again, we're hoping to have it go beyond myself and Joy eventually,
Right.
but
Almost like
start
health
out with.
advocates, right? A health advocate.
Yes. Yeah. Yeah. And so it's a peer health mentoring is the way we like to think of it. And so peer health mentoring. And so we're empowering individuals to go through their own process first, because if you're health focused and if you're health interested, it's good for you to go through your health process and really establish yourself as your healthy living practices, establish yourself as health oriented, and then be there for the people in your life that are maybe struggling, and start to ask those thoughtful questions and not tell them, shake your finger, tell them, well, I told you should have done this, this, and this. But what do you feel like you could do to make it better? What would you like to do? What is the next step for you to you know get to where you aren't struggling with your blood sugars or
Sure.
fatigue or pain? What would you like to investigate, and how can I help you and be there with you as you do that, and have the confidence to be able to do that for the people that you care about, the people in your life. And then that really being there at doctor's visits, it's kind of the next level in that. If that person that you're mentoring needs that presence. And I feel like, especially if you're going into the unknown and you're investigating symptoms that you don't know, like, I don't know what's going on here, it's best to have that at least one person either present or on the phone. I've done phone advocacy for my daughter, when I can't make it to doctor's visits.
Sure.
And then I have her put me on speakerphone. We make sure that the provider knows. We tell the nurse that, hey, I tell her to say, my dad's going to be on speakerphone. He's just going to be here to listen, make sure that I'm communicating what I need to communicate, make sure I get all the information. And I have yet to find a provider that said no.
Right. Right. So speaking of
So,
your kiddos, you have two adult kids and one nearing adulthood. And so how has your parenting approach kind of shaped and supported their lifestyles in terms of health and well-being?
well, kids are kids, and and I think that what you realize over time, as they go through, especially as they go through their teenage years, is that they are truly their own individuals. They are not a they are you can see yourselves in them, but they're not a reflection of you.
Sure.
That makes sense.
Yeah,
So
well, I mean, I'm parenting an almost 8-year-old, so I'm
yes,
catching on quickly.
yeah. Once they get into that those years where they're immersed in schooling with other children, with other influences, then they start to take pieces of other
Sure.
influences and start to incorporate into their vision of the future, their vision of themselves. And you have to just let that happen in a lot of ways. And even if they start to make choices that you don't that you hope they wouldn't make, or
Yeah.
my kids don't eat as healthfully as I would like them to. They don't
Hmm.
adhere to the healthy living practices that I exemplified as they were growing up. But when they were growing up, our house was a healthy living household,
Sure.
right? We had boundaries and barriers on what was allowed in our pantry.
Hmm.
And so it's about adhering to your own standards and making sure that your home is a sanctuary for that. And then that shows them that their home can also be a sanctuary for that. And then again, it's like we were talking about with the health mentoring. Even having been a professional and really having adhered to this type of living for really almost throughout for the majority of their raising, the majority of their lives, that they started making their own choices, and I still have to be that health mentor to remind them that some of the things that they're experiencing in their body is maybe a part of their lifestyle has
Right.
something to do with that. And then just sitting with them and reminding them what they've experienced with us, and putting those options in front of them when they come to visit, and just helping them go through those conversations about what they can do with their lives. And again, asking that question, what do you need from me?
Sure.
Right. And so that's where at some point you go from instructive to supportive, like truly supportive,
Hmm.
where you're honoring what their needs are, what they feel like is best for them in this moment. Even if you don't 100% agree with that path, you can
Right.
inform and give them, some information that, well, maybe you could look at it this way. But if you start to tell them, it's going to really push away, if that makes sense.
Yeah, no, I mean, it's their own journey and you want them to have autonomy. And like you said, it's,
Yes.
a matter
Yes.
of supporting at the level that they want your support. So, how can individuals connect with you on Norma, or how can people learn more about Norma? And I'll put it in the show notes, but I just want to make sure that our listeners have a
Yeah.
way to check out your website. I know you have, maybe you want to share a little bit about the workbooks that you have and kind of how that
Sure.
approach you think is helpful for someone on kind of this exploratory path to healthier living.
Yeah, thank you, thank you. Yeah, we're on all the channel, not all the channels. We're Instagram and Facebook. Haven't cracked the code on the Twitters and the all like
Blue
X
Sky
now, I
and
guess.
all. Yeah, you're
Blue
on.
Sky and TikTok or whatever. I haven't cracked the code on any of that yet. But YouTube, Instagram, Facebook, you can find us at norma.healthyliving. So Norma, I need to say, is NORMAH. So it's a play on normalizing healthy
Yeah.
living. So Norma H. So you can think of it as Norma or Norma H dot healthy living. So Norma dot healthy living on Instagram, Facebook, and YouTube. So you can find us there. Our website is Norma, Norma dash H.com. So Norma dash H.com. And so that's where you can learn more about the Healthy Life System. And like Johanna was talking about, the workbooks right now are solely a part of that process. We're looking at maybe making them available just on their own, and so folks can just look through them and get started, and just come to us when they're ready to really dial it in. But yeah, the Healthy Life System is really centered around these workbooks that are really kind of guided self-reflections. And so they go through this process again of personal reflection on what does health and healthy living mean for you, mean to you. What do you see yourself as? How do you see yourself living if you're living a healthy life? And then how can you start to establish those foundational health oriented practices, build upon the things you're doing already, and really start to orient all of your daily decision making in that direction. And we like to say that it's not only healthy living practices, but it's also health oriented decision making skills. So every decision you make, but it's also that adaptability. So you feel like you're not only able to establish healthy foundation, your healthy living practices, but you're also able to adapt those practices as your life changes, because your life will change
Sure. That's a
as
guarantee.
life
It
goes on, as
changes.
time goes on. Inevitably, yes. The only thing certain is life is that things will change. And so
Yeah.
how can you develop confidence in your ability to adapt to changing life circumstances? And so that's a big part of all of that. But it really starts with dialing in and figuring out what health and healthy living looks like for you in this moment, and what you can do. Like we said, it's the most important thing is what you do every day. And so how can you bring healthy living into your everyday, and normalize healthy living? So normalizing healthy living, kind of coming back to that kind of full circle, real quick, is not only establishing those healthy living practices as normal for you, and so you feel like you're not struggling to adhere to healthy living in your daily life, but it's also that mentoring piece. And so once you really establish it for yourself, then it's helping others in your environment and in your purview and in your life that are normally in your life, start to be more health oriented. And so then they can support you and you can support them, and it's a normal part of your interactions. But I also want to stress too that normalizing healthy living is really whatever it means to you. And so if you're not athletic, it doesn't have to be a big athletic endeavor, right?
Sure.
If you're starting from scratch on healthy eating, it doesn't have to be perfect eating, right? And so really it's whatever is normal for you, whatever health means to you, that's normalized healthy living for you.
Yeah.
It's not a reflection of anyone else. It
Yeah.
is your journey.
Yes, I love that. I love that. Well, I'm excited. I saw the workbook. Kevin gave me a sneak peek,
Yes.
and I
Yes,
really
you give you a
enjoyed
sneak peek.
what I saw. I think that anyone, no matter where you are in life, what stage of life you're in, what your health and wellness goals are, I think anyone could benefit from what this workbook entails. So I will link to norma-h.com as well as all of your social channels, Kevin. I really am grateful for not only our friendship, but your time and support as a peer wellness colleague and mentor. So I would consider you a health
Thank
and
you.
wellness mentor to me as well. And I'm very excited
Appreciate that.
because you mentioned your wife, Joy, and I believe she will also be a guest on the podcast coming up. So stay tuned
Yes.
to hear more about Joy and her own journey with health and well-being. So, Kevin, thank you so much. It's been great having you on, and I look forward to speaking with Joy.
Yeah. Thank you, Johanna. We really appreciate you and your support. If anybody out there wants to have a conversation about any of this, feel free to message us on social. We'll definitely get back to you. And again, thank you so much for opening this space for us, and holding this space for health and well being. We really appreciate you.
Awesome. Thank you.
Thank you for listening to Emotion Well. Employee and Family Resources, or EFR, is a 501c3 nonprofit organization located in Des Moines, Iowa. We support communities, workplaces, and schools with comprehensive behavioral health services. If you would like to contribute to our mission, please click on the donation link in our show notes.